I'm P.V. Rao. I'm a former professor of endocrinology at Nizam Institute of Medical Sciences. Right now, I'm heading a diabetes research center in Hyderabad. I'll speak to you about type 1 diabetes. So most of us know about type 1 diabetes as a diabetes that occurs in the young people. Young is below 15 years of age. They are not children, but they are children as well as young adults. So young adults, that is adolescents. So diabetes may occur not very frequently in young adults and children, so below 15 years of age, and it may sometimes be a diabetic with type 1 affliction. So type 1 or type 2 or other conditions are also seen in children below 15 years, but suppose unfortunately some of these children below 15 years, if they have type 1 diabetes, then that means they have absolute insulin deficiency. Type 1 diabetes is not extremely common, but basically you see about hardly about 1 out of 10,000 population in India have type 1 diabetes. So that means about 1% to 5% of the population who are affected with diabetes may end up with type 1 diabetes. Type 1 is absolute insulin deficiency. Unfortunately, these people below 15 years who are absolute insulin deficient, they should be treated with insulin injections at least twice daily, or sometimes three times, or sometimes 4 times a daily throughout their life. That is a major issue with these type 1 diabetes. They may have to be on insulin injections frequently every day for next several years until their life. So this is a bad situation. Type 1 diabetes occurs because of mostly autoimmunity. So some of the antibodies which are supposed to be causing your disease resistance, that means the antibodies which cause your immune competence, that means the antibodies which help you in preventing the infections like bacteria or virus or fungus getting into your system and affecting your organs. So these antibodies sometimes, instead of or along with working against outside organisms, they may also work against your own organs. So that is called autoimmunity. So because of autoimmunity, you may have some of these antibodies which are affecting your own pancreas tissue, which causes insulin deficiency, or these antibodies may be effective against your blood vessels or nerves. So antibodies mostly known as GAD antibody, islet cell antibody, and insulin antibody. These antibodies are the major causes for development of diabetes, which is called type 1 diabetes in children. So these antibodies are very difficult to treat, very difficult to identify also, because they may or may not be seen always, but mostly if you do those sophisticated tests to measure their GAD antibodies, you may see those antibodies in the blood, but sometimes you may not see those antibodies. But people with this kind of GAD antibody or islet cell antibody or insulin antibody, there are so many other antibodies also, zinc transporter antibodies are there. So with this kind of antibodies you develop diabetes because your own organs are affected by these antibodies, and either your insulin hormone is deficient, or sometimes the insulin produced from pancreas also may be abnormal. So there are that kind of abnormal insulin molecules are also secreted. So in this situation, you have diabetes, and which is called type 1 diabetes. That's immunodeficient that is basically insulin deficient diabetes. That is type 1 diabetes, and these people have to be treated on insulin. Unfortunately, these people are more prone for developing small vessel disease. Small vessel is kidney and eye. The blood vessels in kidney and eye are small. They are like capillaries. They are very small lumen vessels. So people who are affected with the type 1 diabetes may develop one of the complications related to their kidney and eye more frequently than the complications of heart and brain and legs. So these microvascular diseases cause nephropathy, which leads to kidney failure, or that may cause to retinopathy, it may lead to blindness. So this is a major problem with type 1 diabetes who are not properly treated. In countries like in India, we have tuberculosis very common and very frequently seen in India than in other countries. So tuberculosis is a very common condition in India. So people with type 1 diabetes, if they are not properly treated, they may have immunodeficiency, and because of immunodeficiency, their disease resistance power is less than it is supposed to be. So we are the children with type 1 diabetes who are not properly controlled, they may develop one of these bad infections like tuberculosis or even fungal infections like mucormycosis. So tuberculosis is the major cause for morbidity in India with type 1 diabetes. So we have to be more careful about identifying tuberculosis in diabetic children a very early age, and so that we will be able to prevent, or at least we will be able to reduce the burden of tuberculosis by treating tuberculosis effectively.